Hi, this video is for users of MedicalDirector clinical software and will demonstrate how to record an immunization in a medical record. With your medical record open, click on the tab marked IM. This will display any previous vaccines given at your practice and entered into your patient's record. You can add a vaccine by going to the top left of the screen and clicking on the red plus and entering that information. Alternatively, from the IM page, you can simply right-click and add new item. There is a tick box if you are entering information about a vaccination administered elsewhere. Alternatively, select your vaccinator from the drop-down list, who is providing consent, the date, and then click on the drop-down list next to the type and simply start typing the first few letters of the vaccine. Enter the site of administration and the sequence should there be multiple vaccines in the sequence. Enter a batch number. You can also add a comment if appropriate, for example, if administered by a nurse. You can mark for recall and save. Different screens display depending on whether your patient is an adult or a child. I've now moved to a child's file. I'm in an 8-week-old baby's file. Click on the immunization page, right-click, new item. Note the childhood immunization schedule now appears. For combination vaccines, click the green plus. When you tick that green plus, a list of recommended scheduled vaccines will appear for selection. Again, we have the vaccine given elsewhere tick box, should you be entering information for immunizations that have been delivered elsewhere. We also have a pre-ticked box send to AIR, and this is very important. This information will be transmitted electronically from MedicalDirector through to Praxoft and the AIR. The vaccinator, select from your list who provided consent, the date, enter the batch number, and the vaccinations administered. The site, a comment if appropriate, and OK. You can add a recall at this time, and because you selected from coded lists throughout MedicalDirector, it will calculate the appropriate anticipated interval. However, you can change this and save and save. You will then be presented with an information sheet which you can give to your parent or carer or patient. Do you want to record the printing of this leaflet? I would suggest yes, as this will document in your progress notes that this information was printed and given. Correctly recording immunisations in a patient record is important for a number of reasons. Firstly, it ensures that all providers can easily identify immunisations given or due and can work with the client to ensure that they are up to date with relevant immunisation schedules. Secondly, it helps to improve the accuracy of internal reporting, quality and recall management systems within your health service. Finally, it ensures that external systems that depend on your data are accurate. This includes the Australian Immunisation Register, funding providers you are required to report data to, and external quality and research organisations working to improve health outcomes of the wider population. Immunisations help keep people well.